Welcome back to LSS Holdings and our COVID-19 series. This week, we're going to be discussing a guide to health and wellness in 2020. These sessions are brought to you by LSS Holdings, which is comprised of our divisions, Hughes Environmental, providing environmental facility cleaning, duct cleaning, ceiling and rafter cleaning, and combustible dust remediation nationwide. LSS, Life Safety Services, providing fire and smoke damper inspection repair, fire door inspection repair, fire stopping, UVC lighting solutions nationwide, and now launching SafeNetics. It's the e-learning certification platform with inspection technology application launching in 2020. So as we each week explore the topics surrounding currently COVID-19 with the overarching goal of promoting education and awareness on life safety topics, I think it's critical that we take, a moment to look at health and wellness during this pandemic. It's critical to take enhanced measures to ensure your workplace and building is safe before welcoming people back. But it's just as important that your building occupants feel safe and supported too. I want you to know I talk to a lot of building managers and owners, and there's a tremendous amount of effort being made right now to make occupants feel safe, not only feel safe, but to be safe. Once your workplace and your building has been reopened, it is essential to maintain focus on the health and wellness of your employees, patients, residents, and visitors. This will involve adjusting and communicating expectations around new behaviors to ensure safety, security, productivity, and wellness. The positive takeaway on that is that we are communicating all of those topics, and you'll be seeing that now from this day forward, I would imagine. And if there's anything positive to take away about that, is that we are communicating best management practices, real scientifically backed solutions, and making sure that we're all safe. First and foremost, one of the strategies for making sure that not only your employees and visitors feel safe, but also making sure that we do have a better outcome and that we can stay safe is to limit access. So you need to consider restricting or limiting access for amenity centers, conference areas, fitness centers, and locker rooms. Not only do you need to change your cleaning protocol, but how many people can be in that area, and communicating that throughout your building, throughout any social media that you have, so that people are aware of what your requirements are in those areas. Another change that we're seeing is visitor protocol, as well as limiting face-to-face meetings and outside visitors. Communicate your health requirements upon entry into your facility. I'm seeing where people are sending in their visitor protocol prior to arrival, especially where vendors need to enter a building, updating your vendors on what's required to work in the building now. Another requirement might be document visitors' travel history. And you will need to provide cleaning stations and implement no-touch policies in reception areas. So not shaking hands, not touching any longer. Create shipping and receiving protocols, including use of UV wands and other UVC lighting to disinfect any inbound shipments. You need to create a well-being and content for your employees to have at their fingertips, to reference. Many times it takes several times before we really fully understand a subject. So, don't be hesitant to not only have this content throughout your business, but as well as repeating that content until it is commonplace and the behaviors have changed. Some ideas that we are using and that we see other people using successfully are webinars, e-learning content, and then tips to mitigate anxiety. Anxiety is definitely prevalent now, as we don't know what's going to change from day to day, and tips to be able to help people with that anxiety are greatly received. You might print some frequently asked question guides to pin in cubicles and offices with protocols for social distancing, as well as signage, both on the floor and at eye level. You also will want to provide hand sanitizer stations and disinfecting wipes and masks so that you have total compliance throughout your building and that there is accessibility to whatever the occupant needs to be safe. And then you will need to hold training on respiratory etiquette. And this might need to be done frequently until it becomes common behavior. As you see in the news and out and about, we're still not, as a society, our behavior has not entirely changed. Set a temperature threshold over which employees will not be allowed to enter the building. The CDC considers a person to have a fever when he or she has measured temperature of at least 100.4 degrees Fahrenheit. Many employers have adopted screening thresholds in that range of 100 to 100.4 range. You do need to appoint someone with proper training, ideally an on-site medical staff person or other medical professional. Would be an example would be a nurse or someone who has some certification with healthcare. You need to also make sure that documentation is maintained and that you have the training to provide these on-site temperature checks. As I mentioned, we recommend that you provide respiratory hygiene stations to prevent the spread of infection prominently for your employees and building visitors, and that you keep them stocked. This would be another example of being able to provide that peace of mind to your visitors and your employees as well, letting them know that you recognize that it will make them feel safer if they know that these tools are available to them. And our recommendation would be 2 boxes of masks at all time, 1 larger box of tissues, pump bottle of hand sanitizer, and signage. Again, communicate, 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 and then removable drip trays. You also need to establish flexibility in the work site. Limit work site access to only the essential workers and communicate that out to your staff. Establish flexibility in work hours, and you need to keep your building capacity in or around the 50% range and promote telecommunicating and maybe staggered schedules. With this pandemic, it's been a challenge for not only employees, but for leaders. And how do we support those remote workers? It's definitely a brand new day in the work world. And this has brought up many conversations and many best management practices, but this is constantly evolving on how we can ensure that remote workers, whether they're people that have been working at home, or whether they're people who are new to the companies, or whether they're people that have worked in the office for the entirety of their employment, you need to make sure that they have the right tools to work from home successfully. You also need to establish protocols and guidelines to drive productivity. We still need to run a business, more so now than ever. And how do we make sure that we stay connected with the employees and drive that productivity and do it successfully? You know, it was really paramount that we keep employees who are new to remote working to be heard so they can be supported. Get that feedback, understand what they're dealing with and how you can work through that together. There might need to be flexibility on both sides to be able to get the right outcome. So here's some ideas. You need to measure employee perceptions of their working from home space and technology. Hey, how does this feel? Does this feel right to you? Does this feel normal to you? You might hear some employees say, I don't like working at home. I really miss being in the office. So you need to understand how working from home impacts that productivity, including the ability to collaborate and perform focused work. Don't assume that that employee doesn't need meetings any longer and that they're just pushing away all day. And in fact, maybe sometimes they might be pushing away and working so hard that they don't give themselves that life balance. Learn how working from home impacts their work-life balance. Ask those questions. You know, spend some time with them, getting to know them and learn from what they share with you. You need to implement appropriate display, screen, and equipment processes and protocols. And you need to develop home working training programs. Back in the office or back in the business, social distancing is key. And letting people know exactly what 6 feet means may be a constant commitment to you as the employer or the property manager. So we all need to increase our awareness around the 6-foot rule, and we need to stagger shifts and promote telecommuting. And we need to revise and revisit seating arrangements. We can still have meetings, we can still get together, but we're going to have to be very aware of what 6 feet really means. We can also use virtual meetings, even for those working on the same floor in the same building. And we can stay connected and do that safely. Use UVC light disinfection technology as well. Let's consider this, especially with the latest CDC article that was launched this week, where they recommend considering using ultraviolet germicidal irradiation, or UVGI, as a supplemental technique to inactivate potential airborne virus in the upper room air of common occupied spaces in accordance to your industry guidelines. So that indoor air quality is going to not only make it safer and make it healthier environment, whatever your business is, but it's also going to give your employees and your visitors and your guests peace of mind. It also might make you very innovative and be more attractive to customers if you are able to demonstrate that you've applied UVC to promote indoor air quality in those high touch areas. There's many different ways, as we've discussed over these last few weeks, of how UVC can be introduced into your business or be customized to be put into your business. So there's UVC light for the coils, which means that you can actively disinfect the air that you breathe on the return going through your air handling unit. And this technology has been around for decades, and you could implement this immediately and see improved quality of air in your buildings. You can also use UVC disinfection wands for high touch areas or on demand. And these devices are extremely powerful. Not all are the same. Do your homework, do your due diligence, look for those white papers so that you can understand the benchmarks that are being used to evaluate that product for UVC disinfection. You can also use mobile remote UVC systems. And again, do your due diligence, ask for the science behind it. These are very quick, effective, safe ways to be able to disinfect remotely areas where your employees, your customers, your visitors might be wanting to either work or be in that space. Ceiling and wall mountable UVC systems are systems that can be used while occupied or not occupied, and again are cleaning that indoor air quality. UVC light disinfection for PTAC units can be installed where you use those wall mounted units. And UVC light for ice machines, and ice machines are not just for food manufacturing or restaurant service. Those are in buildings all throughout our day. The other thing that you absolutely should consider is scheduling an HVAC and ductwork cleaning, making sure that you are cleaning your ductwork and your HVAC systems are proactive, positive steps towards respiratory health. Ensure your employees, especially those who are immunocompromised, are working in a clean environment by taking steps to improve indoor air quality. According to the CDC, consider using portable high-efficiency particulate air, or HEPA, fan filtration systems to help enhance air cleaning, especially in higher risk areas. Ensure exhaust fans and restroom facilities are functional and operating at full capacity when the building is occupied. And also, as we're seeing in these recent weeks, don't forget to schedule your fire and life safety inspections. These inspections and these requirements have not been suspended during this time of pandemic. And now, more importantly than ever, where people are sheltering in place, they are not able to leave as quickly. Fire and life safety inspections are key critical. So make sure you find your reports or that you find a reliable contractor to inspect your fire smoke dampers and make sure that they're inspected and repaired as per code. And make sure that your fire door inspections and repairs have also been maintained annually as they're required. And make sure your fire stop survey and installation has been done correctly and is reported correctly, as you are required by NFPA code to maintain that at all times. Make sure that your above ceiling inspections are still on track or that you implement them. And make sure that you retain life safety consultants if you have any concerns or issues with how to maintain these systems. Photoluminescent egress path markers and exit signage are also key, critical in making sure that people have a safe work environment and can exit the building safely in the event of loss of power. For all of these solutions that we talk about over these last few weeks during our COVID-19 series, we want to make sure that you understand that we can provide media kits, whether you're working with our Hughes Environmental Division or our LSS Life Safety Division. These tools are extremely beneficial in providing that peace of mind and letting not only the general public, but your employees know that you have spent the time and the resources to retain trained technicians to either deep clean your facility, deep clean your ducts and your air vents, but also maybe you've purchased equipment that has been treated with UVC, and this is something that you can proudly display at all times. But these tools are customized for you and are modern and clearly spelled out and give everyone the awareness that you are providing safe measures to make sure that your area is clean and safe. I want to thank you again for the ongoing work and the questions and the projects and the purchases that you continue to make with all of our divisions. And we can't thank you enough. We were here to provide life safety solutions for you wherever you are in the United States. And we thank you for your time that you spend each week with us on these messages. If you have any questions at all, you can always reach us at info@lifesafetyservices.com or info@hughesenvironmental.com. You can also reach us on the COVID hotline by dialing 888-675-4519. Thank you so much, and stay safe, everyone.